Hello, I'm Patel, and thank you for giving me an opportunity to talk about my pilot study on assessment of chronic pelvic pain using an ICS standardization with a new innovative questionnaire. We have no disclosures. So chronic pelvic pain is a common indication for referral to women's health services, affecting 1 in 4 women and costing up to an estimated 158 million annually to the NHS. It is a subjective complaint which is difficult to assess and manage. However, it is important to be able to measure objectively, to measure its burden, impact on quality of life, and response to treatments and interventions. The International Continence Society, or ICS, has defined chronic pelvic pain as persistent pain lasting longer than 6 months or recurrent episodes of abdominal or pelvic pain, hypersensitivity or discomfort often associated with elimination changes, and sexual dysfunction often in the absence of organic etiology. So our study aims included a design of a questionnaire as per the ICS standard for terminology of chronic pelvic pain syndromes. It is a prospective, cross-sectional and observational study. So an original questionnaire was developed for assessment of pelvic pain, location, quality and severity, and its impact on quality of life using the ICS standard for terminology. Expert opinion and patient focus group were consulted for content and face validity, and all women attending urogynecology outpatient department in a large tertiary centre were asked to complete the newly devised questionnaire as well as a McGill's pain questionnaire. The primary outcome of the study was the validation of the questionnaire, with secondary outcomes being BMI, ethnicity, occupational status, allergies, smoking status, and pain-related diagnoses and comorbidities, as well as investigation results. Statistical analysis were performed using SPSS, and following tests were used for internal consistencies such as Cronbach's alpha, criterion validity with comparison against McGill's questionnaire, reliability with Cohen's kappa coefficient, and reproducibility via test and retest within 1 week. The questionnaire design included multiple different assessment tools, including pictorial diagrams for identification of pain location, pain grading scales, as well as qualitative measures such as the impact on lifestyle. Looking at it in more detail, there was 1 specific item for pain location and 8 different items related to pain character and associated features and symptoms, including analgesia, urinary and bowel function, sexual function, menstruation, mood, and lifestyle impact, including both work and social. 153 questionnaires were completed by 103 women with chronic pelvic pain and 20 without pelvic pain as per the ICS definition. 30 questionnaires were repeated after 1 week by the participants to test for reproducibility. The main age of women with chronic pelvic pain was 34.6 years, with a range between 18 to 68 years, with a variation in diversity. The mean BMI was 23.6. All the subscales had a kappa coefficient of 0.64 to 0.76, which was substantial. Cronbach's alpha for the questionnaire overall was over 0.9, which showed excellent internal consistency for 20 out of 21 items, and the 1 remaining had 0.86, which was good. The pain location, type, and severity were found to be strongly correlated between the proposed questionnaire and McGill's. The most commonly reported associated feelings were frustration, hopelessness, and helplessness, low mood, and anxiety. 70% of the women reported difficulty concentrating due to pain, and 93% reported that the pain had impaired their enjoyment. Chronic pelvic pain was associated with stopping of exercise in 82%, work in 80%, and sexual relationship in 89%. There are various ranges of pain triggers and frequencies, most common being sitting, lying flat, walking, and exercise. In terms of pain triggers and severity, the higher VAS scores were associated with change in position and dietary intake of certain foods and drinks. So, can the questionnaire be used as a clinical tool? Well, the findings suggest that there is a good convergent and discriminant validity and internal consistency. The high Cohen's kappa suggest a substantial inter-rater and intra-rater reliability for the qualitative items of the questionnaire. All items of the questionnaire rated good or excellent internal consistency. This suggests that the items are worded appropriately and are of an appropriate sample. Within the questionnaire, there are some items which are consistently unfilled as not relevant, and this may not be apparent from statistical analysis. The questionnaire is comparable to validated pain questionnaires and provides additional information. So the concluding message is, the results suggest that the questionnaire is a reliable and valid measure of chronic pelvic pain in urogynecology. And as the questionnaire was designed by both clinicians and patients, it is clinically relevant and assesses the different aspects of chronic pelvic pain in a patient-user acceptable manner. However, large numbers are needed to validate these findings. But this pilot study is a promising start to develop a reliable, valid, and a useful clinical tool which will aid women in future. Thank you for listening. Please do ask any questions.